Welcome back to Marvelous Mates. I am joined with my beautiful fiancée, Alexa. Alexa, how are you doing?
I'm good. Tired, but good. But I'm always tired,
Yeah,
so.
well, we're getting to enjoy a drink together on the weekend.
Yeah, that's nice.
It's going to be a beautiful recording.
Yeah.
In your short words, what is your job title and a brief description of what it is that you do?
My job title, you could call it a couple different things. Veterinary Technician is probably the most commonly known. I prefer veterinary nurse. Mm-hmm. I do basically everything that a human nurse does, but for animals. I work with cats and dogs primarily. Everything from hospitalized treatments to surgical monitoring to dental surgeries, giving medicine, nail trims, stuff like that.
The whole shebang.
It's all me.
The whole package.
It's all me. And the other girls, but yeah.
Nice. Today we'll be sipping on the Fatal Plus. We're calling it.
It tastes really good.
Explain what Fatal Plus is.
Fatal Plus is, in my practice, what we use as a euthanasia solution. So it is the final injection that we give when performing a euthanasia.
A little dark humor.
Yeah.
It's okay.
It tastes really good.
Great.
It's really good.
Maybe the real one tastes just as good.
Doubt.
Kids at home, don't ingest it.
Absolutely not.
So, let's hop right into it. We'll take our first shot here. Mm-hmm. This is the Bananarama.
It's clear.
You can guess what this tastes like.
I would assume it would be like banana colored, though.
Incorrect.
Ugh. Not a lot of banana in that.
No, it's mostly simple syrup and rum.
It's good, but I'm going to make the same face after every shot.
Yeah, that's why this is here. So let's hop right into our first question here. Mm-hmm. What is the clear differences between you and the doctors? Where does your job start?
That's a good one. That's a really good one. I like to think that the nurses tend to have hands on the patients a lot more than the doctors do. Of course, the doctors diagnose, they perform surgery, script medications. Those are 3 of the things that a technician legally cannot do. So if I'm like doing an appointment and somebody goes, "So what do you think is wrong?" I have to kind of hold my tongue a little bit and go, "I can't say anything because I'm not allowed to diagnose. I can maybe give you a hint of what I think, but I can't, oh, your dog has ringworm." Like, I can't do that.
You can't do that, but are you allowed to at least, like, "Oh, it could be this"? Like, give them kind of, like, play with it just a bit.
In my experience, I've kind of found that that's turned around and bit me in the ass a couple of times.
True.
Because sometimes I'll go in there and I'll be like, "Oh, clearly this is an ear infection or something," and I'll be like, "Okay, let's do this, this, and this," and I'll bring it back to the treatment area, and the doctor will go, "No, the cat has an ear polyp," or something like that, which is totally different, and I'm just like...
they're like, "Oh, well, she told me blah, blah, blah."
Yep, and that happens all the time, especially with the newer technicians. I've kind of advised against doing that, so when they ask me something like, "What do you think it is?" "Oh, well, maybe," but I always throw in, "But I'm going to have the doctor look at it, and they'll tell you what they think is going on."
Right.
I never, ever tell a client, "This is what it is." Because even if I'm right, on that off chance that I'm not right, it could be a problem. But yeah, the major differences I see between doctors and techs, a doctor can do everything that a tech can do. I can't do everything a doctor can do, legally and physically.
Sure.
I can't perform surgery.
But you guys are in there with them doing the surgery.
We're like general practice, so we're not emergency, and we don't do surgery as in like a specialty. We'll have like a surgeon come in for specialty surgeries, like FHOs and stuff like that, and knee surgeries, bones, stuff like that. But every now and again, we'll scrub in to like help hold
scalpel kind of thing.
Well,
Or
we'll like drop stuff on the table for them, but we'll scrub in more specifically if they're doing something like a foreign body where they need extra hands to hold tissue for them. Because your fingers are a lot less traumatizing to something like intestine than some of the surgical instruments are.
Yeah.
I can't surgerize. I can't script medications. That's the main reason why I don't really want to go into doctoring, because you don't get to have that hands-on with the patients as much. You deal more with the client as well as a doctor.
Okay.
You're doing more of a, okay, I have to go make a couple of phone calls. I have to go talk to clients. I have to go talk to pet owners. I have to go talk to other doctors about recommendations. You're not dealing with the hospitalized patients. You're not performing the treatments as a doctor.
Yeah.
Generally, here are my orders, nurse, go do my orders.
Right.
Which, that's what I like doing, so...
Oh, well, then it works out then. So.
That's what I have fun with, spending time with the patients and getting that reward of helping them feel better by the end of the day.
Yeah, that leads us right into our next question here, but we're going to take our next shot here.
Already?
Yeah, already. I know, boo.
What's
this
one?
is the lemon drop.
Lemon drop?
Should be nice and easy.
Usually I like these.
It's like a little Mike's Hard.
Let's see. Ooh, sour. Mm-hmm. Better though.
Yeah, definitely better.
Better though.
Definitely better. Little Mike's Hard. Mm-hmm. Do most vet techs have a hard time separating emotion, or do you try to keep emotion into it when you're dealing with
that is another
trauma and things like that?
Really good question. Sometimes it's really difficult to separate how I'm feeling about a certain patient or about a certain client even from... It's hard. It is definitely, for me, it's difficult because there will be situations where they come in and you worry about the pet not getting the proper treatment because either the owner just doesn't want to, or they can't afford it, which is not their fault.
Sure.
Or they don't know any better. Me in particular, I've kind of been a little bit better about having some grace with people, but I'm also kind of a cynic, so it's hard. I get particularly attached to certain dogs.
I'm assuming that they're regular patients and
yes,
you see them
we have our frequent flyers that come in all the time. I don't want to name any like specific patient names, but for any of my fellow nurses that are watching this, there is one little specific black scruffy dog that comes in for boarding all the time. Her name starts with a B. I think we'll all be very, very, very sad if something were to happen to her. We've had a couple of old timers come and go, and I know a couple of the other girls get super attached to our old doggies and our old kitties, and there was another one not too long ago that we lost right after he came in for boarding, and we were all really upset about that. We do get attached. There have been a couple that I've cried with, owners, when they're saying goodbye, and there are some that I haven't known them long enough to do that, but you get attached to all of them in a little way. Do
people find it comforting when you are mournful of their animals, or are they like, this isn't your dog, you're like, get out of here?
It's hard to tell. Some people, if you know them well enough, do care, and then some people, if you don't know them well enough, do not appreciate it. I tend to err on the side of caution where if I know I'm getting emotional, then I'm going to leave the room and kind of have my moment either in the back with the rest of the technicians where I know I have a support system, or somewhere else where I can just kind of calm down for a minute. Some clients do appreciate it if you know them well enough, but some clients, if they're like new patient, new client, and you don't know them, I always just kind of hide away. I leave so that they don't see that until I kind of get more of a gauge on them and how they are.
And does dealing with passing / trauma, that's not in the official book, is it? Or is that something they actually go over when you're doing schooling, training?
It's been a long time since I've been in school. I've kind of been in the field for 5, almost 6 years now. They should. They very, very, very much should have some formal education in that respect, and we should always have like a support system to fall back on. The other girls are very sweet, and we always comfort each other, especially when like we have a certain patient that, oh hey, I know that so and so really loves this dog, and she's not doing well, let me call her and let her know that something's going on. Like, we've done that for each other before. Or, you know, I know that so and so really cares for this dog, let's wait to tell her until Monday because we don't want to ruin her weekend, like something like that.
Right.
They should have some kind of grief system, or I think every hospital should have something like that. The veterinary profession has one of the highest suicide rates in the country right now.
Good Lord. Wow. Fun fact.
For multiple reasons, but I can't help but feel that is one of the reasons.
Wow. Yeah, I mean, it's something that I went over with Colin in his episode.
Yeah,
being a firefighter.
I'm sure they're on the same par with us. Yeah. It's very difficult.
Yeah, seeing death on a regular basis. Yeah,
at least
even
if
it is,
a week.
You know, an animal, not like a human. I'm sure it still carries.
Of course. I believe
level.
It does. Some people don't have the same amount of empathy for animals as other people do.
Sure.
If you don't have the same amount of empathy for animals as other people do, you shouldn't be in this field.
True. Very true.
For some people, it's harder than for others, but for me, it's never easy.
Yeah.
Even if I don't know them, it's still, I kind of look and watch it happen, and I think of R3 at home.
Yeah.
Every time.
Yeah.
And it sucks, but sometimes it's the right decision as well, so.
Sometimes
it's really hard, but you have to do what's right for them in the long run.
Right. Let's get to our next one here. This is a kamikaze.
Oh. It looked very similar to the other one.
Yeah.
And I said that before, but...
It should be good. Don't worry. Maybe.
Ooh, that's sour. That's really sour.
Yeah, it's lime juice and triple sec.
Yeah, I taste the lime. I bet my face looks perfect right now.
You're getting a little red in the cheeks. But
yeah,
that's
I know.
normal. That's normal. What are the advantages / disadvantages of working with dogs versus cats, or vice versa?
Ooh, that's another really good one. My favorite saying that I learned in school was cats are sharp on all 8 sides.
8 sides?
Yeah.
Count them off, please.
You would think.
What are 8 sides?
You would think you would know, but every time I handle a cat, they show me a new one.
Oh.
So they have claws, and then they have their teeth, and on every foot, unless they're declawed, which that's a whole nother situation that we may or may not talk about at some point here. But I personally prefer dealing with smaller dogs. Mm-hmm. They're easier to they're usually nicer, but I would rather deal with a mean small dog than I would rather deal with a mean cat any day. Cats are fast, they are agile, they are very flexible, and they will bite. Mm-hmm. And not only will they bite, they will maul. I have seen girls come out of rooms with angry cats with arms bleeding. They will mess you up.
Yeah.
And that's why we have chemical sedation. So if we tell you that your animal needs to be sedated, please, it's for our own safety.
And possibly the animals.
Because not only that, they will hurt themselves trying to get out. Mm-hmm. I've seen dogs break teeth trying to escape from various situations. I have seen cats rip nails out and also break teeth. But the advantages I would think working with dogs is they're a little easier to gauge in terms of behavior. Mm-hmm. Cats are a little more unpredictable in my opinion, where a lot of people think that like a wagging tail is a positive sign, and a cat, it is very negative. When they're lashing their tail, that means they're agitated. Mm-hmm. Obviously, fur rising, agitated, ears back, agitated, wide blown pupils, agitated. Mm-hmm. Cats don't really warn you. most of the time before they do something. Sometimes they will just try to bolt, and if you stop them, then, all right, I'm gonna mess you up now.
Yeah.
Dogs, on the other hand, not always true for every dog, but most of the time they will warn you before they try something. They will give you that opportunity to stop what you're doing, back off, and rethink before trying that again.
Yeah.
Some dogs will lunge and snap without any warning, but that's because they've been taught not to growl, probably by their owners, which in that case, most of the time, we get a warning from the owners, hey, he bites. Mm-hmm. And then we kind of know how to go forward from there. Larger dogs, obviously, are harder to handle than smaller dogs. Like Seven, for example, our 10-pound Chihuahua mix that we have. Mm-hmm. Easy to handle for a nail trim, even though she doesn't like it. Now, imagine a dog her size. Nice, not trying to bite. Mm-hmm. Now imagine a dog twice her size, trying to bite. You can't just hold them and say no at that point. You have to break out the towels, you gotta break out the muzzles, and then some dogs really don't want that muzzle on their face. Yeah. And some cats, we have to put, like, basically a mask over their head where we obscure their vision and stop them from biting. Sometimes that doesn't work. Cats are definitely a lot more bendable, flexy than dogs, and dogs are a lot more readable. But in most cases, larger dog, stronger.
Yeah.
So harder to deal with.
Gonna give you a little bit more run for your money.
And we're all women mostly, so it's a very female-dominated field. So I have like maybe 2 or 3 other women trying to help me wrangle a 108-pound pit bull thing.
Sure.
And it's not working. And then we all kind of look over and go, "Can we get one of the male doctors to help us, please? We need strength."
Yeah, that thing's just a yoke. It's more yoked than the doctor. It's just built like a Tonka truck.
I could name a couple off the top of my head where they walk in and they go, "Bark," and woof. You're like,
"Woof."
That? You want me to do that thing's nails?
It's just like, that's a guy in a costume. You're not fooling anyone.
He's gonna eat me. What do you mean? "Oh, I know he's sick, but can you do his nails? And he hates it." Lady, I'm gonna die in a minute. Are you sure? Rethink, please. Let me do everything else before I do his nails, please.
It is always pretty like jarring when you see like big breeds like that, and they're just nothing but little babies, though.
Oh yeah.
It is very, very funny.
I've mostly met more nice pit bulls than I've met mean ones.
Yeah.
Great Danes especially are
couch potatoes.
I like to call them untrained horses.
Yeah.
I would probably be sooner flown like a kite and just have a Great Dane run than it would try to bite me. Mm-hmm. They literally are untrained horses. Mm-hmm. Pitties, obviously, are usually very, very sweet dogs. I've not really met, well, there's 1 or 2, but it's usually like circumstance where they come from, if it's a rescue or not.
Sure.
I've never met a mean Doberman. Never.
Yeah, they're sweet dogs.
All the Dobermans that come into our hospital are the sweetest, nicest dogs. Big chickens sometimes.
Oh, yeah.
Big
For
babies,
sure.
But generally pretty nice dogs.
They're little crybabies.
Most of the Rottweilers that we have come in are really nice. Mm-hmm. Maybe there's 1 or 2 that are a little sketchy, sketch balls, but can't. There's nothing that can't be handled with a towel and some treats and some head pats and hey, you're doing fine, and soft, calm baby voices are one of our favorite tools. We talk to them like this and tell them they're a good dog.
It's like, yeah.
Everybody has a different baby voice for animals. Oh, and the doctors do it too. Well, they'll come up and be like, "Oh, it's a sweet little doggo, a little boy, a little baby boy." And they love it. The dogs are just like, "It's me. I'm the baby boy." And you know, one of the doctors gave me the "is so heckin' delicious."
Oh, yeah.
That I now say all the time. And it now kind of permeates the entire hospital, where we'll give out a treat and go, "Is that heckin' delicious? That was a good doggo." And one of the doctors specifically started that.
Hey, but you know, if it works, man.
It does.
Yeah.
We have a thing called fear-free certification, which I do have my certification in that, and it's a online set of courses that you can take to learn fear-free handling for the animals, which includes like food distractions and touch gradient, where like you start touching them on the top of your head and then you move your hand down and slowly down their arm. You never take your hands off of them. because if you take your hands off and then put it back on, it could scare them.
Mm-hmm.
Stuff like that always helps. And a fearful animal can go from absolutely hating office visits to enjoying them after some time. If you go slow, take your time, give them their cookies and talk to them nice and give them their head pats, and one person talks to them and tells them it's okay, and another person, you know, does the thing that they don't like, or that's what I'm trying to focus on with our new kitten. He took his last set of kitten vaccines like an absolute champ, because he was getting his little lickable treat while he was getting his shots. He did not even notice that he was getting his shots.
He's a good boy.
And we do that for a lot of owners for their first puppy or kitten visit. We'll bring the puppy or kitten into the room. We'll give them treats while we give them their shots, and it's always the same reaction every time. Oh my God, they didn't even notice. Yeah, because they were getting a yummy cookie.
Sure, yeah.
They didn't care about the shot. They were getting peanut butter on a popsicle stick. They were getting cheese from a tube.
I wish if we ever went to the doctor and I was getting like a finger prick or a shot, and the doctor just gave me a Big Mac and they're like, here you go. I'm like, okay, thanks.
Yeah, exactly.
Thank you.
It's basically
Go
the same
ahead.
presents. It's like, here, eat your Big Mac, and then we're gonna do a little sticky stick. Like,
okay.
It works.
Yeah,
It genuinely works. And a lot of people are super surprised when we do it in front of them, and they're like, oh my God. And I'm like, yeah.
It's amazing.
There you go. And then if you kind of work on them at home with this, it'll be even less of a hassle next time.
Yeah, I mean, it is interesting too, the amount of work that even just changing your tone works.
Oh yeah.
Like, you know, instead of
Dogs?
talking to a dog like this.
Oh yeah.
And going, hello, and they're like,
hello, baby. Yeah, dogs 110% understand tone.
oh yeah,
They
sure.
understand certain words as well.
Yeah.
Like you tell them to sit, obviously. But if you're talking to them, you know, nice and calm and soft and smooth, they tend to respond better. Every now and again, if I have a dog snap at me, I'll just do the hey, no. And then they'll give me that exact look where they'll be like, oh, that's mom's voice.
That's the bad sound.
You're serious.
Yeah.
Sometimes you do have to put on that serious voice to get across, hey, I mean business. Don't do that. And then they stop.
Yeah.
Because they're like, okay, all right, I'm not going to get away with it with you then, so maybe I don't do that. They understand tone 100%. They know what your intentions are. Another thing that I like to tell the newer girls as well is calm. I'm not the best at doing this. Especially lately. We've been extremely busy, and unfortunately, I feel like even me, I've been getting overwhelmed, which means I don't get to have that time to kind of take my time on a patient, even if they are stressed or anxious, and I want to. But if you come at them all anxious and freaked out, they're going to respond to that in kind. They are also going to become anxious and freaked out, especially if they already are. So do a little woosah, take a deep breath, calm down, relax, and then come at it with a gentle approach and try to have that energy with them, and then they usually calm down. Unless it's a bad dog. Sometimes.
Which happens.
Sometimes it does not work, and in that case, chemical sedation.
Cool. Let's hop into our next one here.
More. This is very green.
This is a melon ball.
A melon ball.
Mm-hmm.
Oh, it was also really sour. Oh, that was also really sour.
Yeah.
Oh.
Yeah, the next one's gonna be sour too.
Ugh.
Except a lot sweeter too.
That wasn't bad though.
No, they're all.
I always make the
doable.
same like gross face. Every time. Every time.
Yeah. What is the grossest thing that you've encountered on the job so far?
Oh, there's so many things. Oh, I have so many stories, and you've heard some of them.
Yeah. Oh, I definitely have. Cause I'll come home and I'll give you a kiss, and you're like, you don't want to kiss me today. And I'm like, okay.
let me take a shower first. I get regularly doused in pee, poop, vomit,
Sure.
blood,
bodily fluids.
bodily fluids. I think one of the grossest things I have ever encountered, and it's kind of subjective. It's definitely subjective to whoever you're talking to in this field. It was a older Weimaraner. Mm-hmm. I don't know if I told you this story. She came in, I believe we thought it was a foreign body, meaning she had eaten something that she wasn't supposed to, and now it was stuck in her GI tract, which can be a medical emergency. So we took her to surgery, and I assisted with the surgery, and the doctor, who is no longer with us, basically cut the dog's stomach open, enterotomy. Which I think enterotomy refers to the intestines specifically. I want to say there's another word specifically referring to the stomach. Gastrotomy? Mm-hmm. Yeah, gastrotomy. And she just started pulling out handfuls and handfuls and handfuls of grass. Ugh. It was quite literally... We had a bucket about this big.
Yeah.
We filled it, I think, twice or 3 times.
Dear Lord.
With grass. And it was obviously, like, covered in digestive juices and covered in, like, other shit. And there was maybe, like, 1 or 2 chunks of plastic or something like that in there that may have started the whole episode. So what we think the dog did is she felt sick because she ate something she wasn't supposed to. Like, we found, like, 2 little pieces of plastic. And she just went outside and started eating grass like a cow. And
That's
literally blocked herself up with grass. And the smell was... abysmal.
Even worse than like
poo-poo. It was bad. When
Wow.
we do foreign body surgeries, sometimes the stuff that comes out of them absolutely reeks.
Wow.
There have been a couple of stories that I've heard from the other girls that I wasn't specifically there for that are probably worse than that. There was once where a client brought in a dog that had passed away at home. And it had obviously been deceased for quite some time.
Oh, Lord.
And it also had been left outside. So there were maggots in the dog's eyes and other orifices.
Oh,
and
that's
it
lovely.
was really... I was not there for it, thank God. But the girls were like, we were all gagging. It was terrible. There was the time that somebody brought in their dog that got hit by a car and wanted a paw print. I've told you that story.
You've told me that one like 2 or 3 times.
Yeah.
And, man, it is...
We couldn't find a paw.
Oh.
And they brought it in like a gift bag, like one of those party gift bags that you bring to like a child's birthday party.
Oh, no.
And I remember the doctors were like, all right, sift through this and try to find a paw because they want a paw print and private cremation. And me and another girl who's no longer teching with me at the same hospital, I think she's teching somewhere else now. We were kind of like looking down into the bag, and it was just a bunch of meat and bones.
That is
and we were like,
foul.
Where's the dog?
I thought you said they were bringing in a dog.
Yeah, who scraped this dog off the concrete, quite literally? I don't think we found a paw. So that was something.
Lord, what'd you guys sift through the bag with? Like tongs or like chopsticks or something?
Gloves. We just put gloves on our hands.
And just, oh God.
Yeah.
Ugh.
I've been asked to sift through worse. It's when dogs come in and we need to make them vomit for one reason or another. We just had a dog came in the other day that ate the air tag off her collar.
Oh yeah, you sent me
and
a picture.
I have an X-ray. I have a picture of the X-ray, which is hilarious because you can see the air tag very clearly
Actually,
in the dog's stomach.
Send me. I think you sent me the picture.
I can send it to you, and we can put it up on the screen.
I'll throw it up on the screen.
You can very clearly see the air tag of the dog's stomach.
It's a pretty funny picture.
But when we have dogs come in that we need to induce emesis, is the medical term for that. When we make them vomit, we give them an injection called apomorphine, and they vomit within a minute. It's really fast. It's crazy quick. Yeah. We have to comb through the vomit for whatever we were looking for.
Yeah.
In that case, that dog vomited twice. Vomited up pieces of a toy as well, which we didn't know was in there. And she vomited up the air tag, and I was like, "Yay! There it is!" And everybody like started clapping, and everybody's like, "Yay!" Because we were worried it wasn't going to come up.
Sure.
I felt bad because I gave that dog a bunch of food beforehand to like put stuff in her stomach to kind of cover the air tag, so that it would all come up.
Now, I wasn't there for obviously any of these, but personally to me, I would find the bag of dog
that
probably
was...
probably the I mean, I wasn't there for the grass thing. It could have been a lot worse.
I was used to, like... I'm used to surgery, so I'm used to kind of blood, guts, viscera. Like, I'm used to that stuff.
Sure, yeah.
I'm also relatively used to seeing dead animals. Like, it's kind of like you get desensitized to that sort of thing after a while. I wasn't there when it happened, and that's the important part. I didn't see the dog get eviscerated, basically. So when they presented us this bag, I was kind of just like, oh.
Lovely.
It was traumatizing.
Yeah.
Gross, but the smell that came out of that Weimaraner with the grass.
Ugh.
I keep meaning to get like a little bottle of peppermint to keep in the hospital so that we can wear surgical masks and dab it onto the surgical masks so that when we get presented with smells like that, we can just walk around with the masks and just smell peppermint. And that's a trick that I think other practices use pretty regularly. Puppy that vomited up used condoms was something that happened while I wasn't there.
Yuck.
There was a cat.
How did you guys know they were used?
She told us. Well, she didn't tell us. She didn't really want to tell us at first, but she was like, he got into my trash.
Ah. You never know. They could have been new.
No. You're shaking it. Which, it happens. Accidents happen.
Sure, yeah, I mean...
And a puppy kind of getting into something like that is not...
surprising.
Not really. They've gotten into worse. They've definitely gotten into worse.
Yeah, I remember when we had our Doberman, or my sister's Doberman, kept eating her panties over and over and over and over.
We've made dogs vomit before because they ate a sock and then there's like 4 socks in here. Somebody has been getting into the laundry. You gotta put a basket muzzle on that dog. What are some other things? A cat with maggot-infested wound. I've seen more bugs than I would like to admit. A puppy with more ticks in its ear than it had ear.
Now, correct me if I'm wrong, because obviously I'm no expert, but the presence of maggots means that there's dead flesh, correct? I mean,
so maggots aren't generally like, they don't eat healthy tissue as far as I'm aware. They eat basically diseased tissue.
Dead.
You don't want maggots in a wound.
Sure, yeah, of course not. But
infection and all that usually means that there's like infection present at that point, and it's been given time to like fester and kind of.
Yeah, but the maggots eat away the.
They do. So usually in that case we'll kind of clean away the dead tissue. We'll do like a debridement sometimes where the doctor will take a scalpel blade and scrape away the dead skin.
Yeah.
And then we'll either suture it closed
and
or
throw a handful of maggots on it.
Yeah.
You guys have them on tap, right?
Yeah, absolutely. Don't you know that we have a jar full of fleas that we put on dogs so that we can sell flea and tick preventative?
That is some crazy conspiracy.
Yeah, I have had at least one person tell me that we put fleas on the dog.
Oh, Lord.
You did that. Ma'am, why would I?
Why would I do that?
Why would I do that? So that you can sell your stuff to me. No. No.
Wow. All right. The next one. This is the blue balls.
Oh.
I think this is the best one.
I hope there's a question that kind of goes along with that. Because there could be. Ooh. That one's pretty good. That's smooth.
Yeah, it's like candy.
It is, a little bit.
Ironically, I think it's like the strongest one on here.
It's strong.
Yeah.
I can taste it, but it's very candy-like.
With more and more people using things like WebMD and you know, you said the other day it's Dr. Google.
Oh yeah.
How has that affected your job?
I do not mind people educating themselves. I think it's a good thing. I think it's a great thing, actually. but our veterinarians went to school for 4 years and then some. So, I actually learned something the other day from a client that I didn't know was a thing because he looked it up online. Huskies can have zinc deficiencies.
Really?
Which can then cause certain, I want to say, skin-related issues. And he brought this up in the room when I was, doing the appointment, getting my history, and he was like, yeah, so I read online that this could be along the lines of a zinc deficiency, so I started putting him on zinc supplements. Is there something else I can do? And I was like, again, like we talked before, I don't know, but I'll bring it up to the doctor and see what she thinks. So I wrote it down in the note, and then I talked to the doctor, and she was like, yeah, that's a thing. And I was like, oh, I didn't know that.
Oh, wow.
So there are some things that are valuable to be learned online. I think the internet is a great place to learn about things that you're curious about, and I think it's a great place to learn about things that you want to learn more about. And
like right now with this show.
Like right now with this show.
That's a shameless plug, but I'm sorry.
I think it's great. But I also think that people should remember to consult with their veterinary professional before doing things. I have nothing against homeopathic remedies, but I don't think that diatomaceous earth is going to get rid of the fleas in your house. It has been proven to not actually work. And the internet has also been a proponent of spreading pretty not correct information as well. There's something going around, I don't know if it's still going around, but it was relatively recent, where people were saying that flea tick heartworm prevention causes seizures. It does not cause seizures. What happens is dogs that already have the potential to have seizures or do currently have seizures, it lowers that threshold. So it might cause them to have more seizures. It doesn't make seizures start happening out of nowhere. It does not suddenly give your dog a neuropathy. It doesn't do that. What it might do is, if your dog already is prone to something like that, lower the possibility of it happening and make it start happening.
Like increases the frequency if it's already happening.
It increases the frequency and the risk of it happening if it's already happening. So that's why we usually ask people, does your pet have a history of seizures? Does your pet, have a history of being on medication? Stuff like that. Have they ever had any ill effects from any medication that they've been on previously? That's something that any good technician will always ask with a new patient, new client, or just in any room in general. They'll try to kind of assess the history of that specific patient. Now, the internet specifically has kind of criminalized stuff like that and decided, no, it just causes seizures. It just makes them have seizures and kills them. That is not true. I have my own personal dog, our dog, on flea tick and heartworm medication every single month, and not once has she ever had a seizure. That's not to say, as she gets older, will she maybe have a seizure down the line for some other reason? Who the hell knows? Maybe. She's a technician's dog, so the likelihood of that happening is higher.
Oh, the curse?
The curse. There's always something wrong with technician animals, most of the time. The craziest things tend to happen to us, but it doesn't. Flea tick and heartworm medication is a preventative. It's meant to help your pet from getting sick. It does not make them sick. Now, if your pet has an intolerance to it, it makes them vomit or have diarrhea. That's not something that I haven't heard before, and it is possible. So then we'll try to work around you. But I do not think that looking up on Google and deciding that this homeopathic treatment for hookworms that you found online, I don't think that's gonna work. You can try it.
Yeah. You
can, but do not be surprised when you come back to us in 6 months and go, my dog still has hookworms.
Yeah. Now, is it a lot more respectable and favorable if somebody to look something up online about their dog or their breed or whichever, and they come in and they're like, hey, I read this thing online. Excuse me. I read this thing online. Could it be this? Instead of them coming in and being like, I read this online, this is what it is.
Right.
Treat it.
Okay.
Like, is that a much more...
I have absolutely...
a much better approach.
Yeah, I have absolutely no issue with somebody coming in and going, hey, I looked this up online, or a friend of a friend told me that it could be this. Can we, like, look into that? I like to take my notes and be very descriptive, and I like to write down word for word what people are telling me in the appointment rooms, so that they can be like, if they're... I didn't say that. I can be like, yes, you did. I wrote it down.
Yeah.
I wrote it down verbatim.
Like the person in a courtroom.
Yeah. The doctors will literally sit in their office and laugh at my notes, because whatever silly things comes out of the client's mouth, I write down. It's just CYA, cover your ass.
Yeah.
But if a client comes in and says, hey, I looked this up, can we, like, look into this? Absolutely, I will bring it up to the doctor. Mm-hmm. I have absolutely no problem doing that. But if you come to me and a client says, my dog has, or my cat, that's a better example, my cat has been ravenously eating, drinking a lot of water, urinating a lot, not gaining any weight, is doing all sorts of weird stuff, I think that it's this. Treat this. And I'm like, your cat's a diabetic. And they're like, no, absolutely not. I don't want to do blood work. I don't want to do this. I don't want to do that. You should treat it for something else. Ma'am, that's not going to help. No, I want to... The doctors as well will all get the same amount of, like, here we go again. Because it's sometimes the same clients. And I do believe that they always have the interest of the pet at heart.
Sure.
They care about their animals.
Sure.
It is an art to learn how to talk to people in a way, in my opinion, especially to kind of present them something where they think it's their idea, and then they accept it a little bit more easily.
That's true.
But it's definitely an art to kind of gently talk to people. Every animal comes with a person attached to it. Mm. And that person is the decision maker. Unfortunately, not you, not the doctor, it's the owner. What they can do and what they think. And if the doctor thinks that something is right, the doctors as well have a very special way of talking to people and calming them down and going, hey, this is what I think is going on. We can do this if you really want to. Like, we can. Yeah. But I don't think that that's what's happening here. The likelihood of A versus B is lower. So I say we investigate B, and if you really want to investigate A, we can.
Yeah.
But one specific thing that they like to say that I really like when they say it is, I don't want to waste your money. Let's focus on this. Mm-hmm. And clients tend to kind of change their attitude when you go, hey, I don't want to waste your money. This is what I think is going on. We can go after that if you really want us to, but it might come up with absolutely nothing.
Yeah, I always find what another common saying is, like, the most obvious solution, it's probably it.
Yeah,
a lot of the times.
A good one that we have is if you hear hoofbeats, think horses, not zebras.
Yeah. I mean, that's a good practice. I mean, I think your job is very different from a nurse's. Not necessarily worse, harder, whatever.
I would never want to deal with people.
Sure,
I have mad respect for human nurses.
I think arguably the biggest difference between the two is you can communicate with the patient for the most part. I mean, obviously, when you're dealing with infants, you're dealing with infants, it's a little different. But with it, when you're dealing with an adult, my arm hurts. Okay, let's get started on your arm. But with a dog, it's like poke.
Yeah, it is quite literally. You've seen me do
a check on the dog. I've seen you do it. When she was
limping that one time, and I probably did not do it quite right, but I did figure out where.
Yeah.
Sometimes people will say, hey, my dog's been limping for however long, and I've tried a couple of things and nothing's helped, so what's going on? Dog is bouncing around the room, happy, fine, acting like nothing is wrong. Yeah. They're totally normal. They're okay. Everything is, like, hunky-dory. and we'll take them to the treatment area, and when they're limping, we usually check everything. So, like, we'll check their neck, we'll check their back, we'll check their back legs, we'll check their front legs, elbows, paws, wrists. We will check everything. If they don't give us a yelp or tell us where they're hurting,
sure,
we don't know. There's no way for us to communicate that with them and go, hey, Fluffy, is your back hurting? Is your neck hurting?
Is your throat dry?
Is your throat dry? Are you coughing? Like, we can't talk to them.
Yeah.
Human nurses, sometimes for the most part, can communicate with their patients or human doctors and go,
sure,
where does it hurt? On a scale of 1 to 10, how much does it hurt? We have to gauge that.
Based on
what they're doing.
Yeah.
And an important part, I feel, as a nurse in my field, is advocating for patient pain relief and just kind of figuring out where they're at on the pain scale. Our doctors are great at doing that. I have never, ever had to come behind a doctor and go, hey, I think Fluffy needs more pain medication. They are fantastic at making sure that our animals are comfortable and safe and happy and doing okay after major surgeries, including spays and neuters.
Yeah.
We give our spays extra pain medication because we know how painful it can be. Sometimes we'll even give our neuters extra pain medication because we know how painful it can be.
They're getting a good high after that.
They are getting the good treatment.
Yeah, they're getting the good stuff after that visit.
Just you wait until Gambit comes home after his neuter surgery.
Oh.
He is going to be what we call a Bupernex kitty, where we're going to give him some medication that probably goes on the back of his neck, and he's going to be high for like 3 days straight. I'm trying to remember because we have a bunch of new medications that have been coming in lately, and they sound like Harry Potter spells is the joke. Silencia is one of it's for cats.
No, really?
Zorbium is what I'm talking about, actually.
That is a Harry Potter spell.
They really sound like...
you couldn't convince me otherwise.
I want to say the one for the Silencia for dogs is Librella or something like that. They all sound the same, but Zorbium is what I'm talking about, where it goes on the back of the neck.
We should definitely do like a game night where you just come in.
Is it a Harry Potter spell or is it a drug?
Or is it medication?
We can't invite Colin because he'll know.
Yeah, that's true.
He'll know.
He'll be cheating.
But it'll be really funny if I get him to collaborate with me on that.
Leviosa. Medicine?
Ondansetron. Medicine? And you don't know. But
that's funny.
We're very good advocates for making sure that our patients are comfortable, especially after stuff like FHOs, which is femoral head osteotomy, where we remove the head of their. Basically, it's because they have bad hip dysplasia, and we remove the head of their femur so that it forms like scar tissue, and they can move better in the long run. But we're very good at advocating for patient pain relief. And the doctors, I have never had to come behind them and go, hey, this dog's really painful. I think he needs more. Maybe once in a blue moon, but that's because the dog either has a really high pain tolerance or isn't responding to the medication. And sometimes we'll have one every now and again where they're just like, nope, I do not feel this medication. I want to scream. Oh. And...
Drama queens.
Ketamine is a hell of a drug. We do not like using ketamine. We use it quite a lot, but it is very much, it makes them dysmorphic. It really freaks them out. Most of the animals that I wake up after being on ketamine do in fact wake up yelling and screaming, and I feel very bad because they just are... The devil's trying to steal my kneecaps! Like, they don't know what's going on, and... Again, same point. I can't tell them, hey, everything's going to be okay. You just woke up from surgery. Calm down. It's all right. They don't know what's happening to them.
Sure.
They don't know what's going on. All they know is that they fell asleep, they woke up, and now they hurt.
Yeah.
That's all they know.
Yeah, Louis C.K. has that great bit on that with the Ipecac where he's trying to make the dog vomit.
Trying to give his dog stuff in the bathtub. Also, I don't recommend doing that. Don't do that at home, please. I'm begging you, don't do that at home.
He bought the Ipecac bottle. Don't do that. To make don't do it.
Don't do that at home. Please call a veterinary professional and bring your pet to a veterinary hospital to be vomited if they need to vomit. Please, I'm begging you. Do not give them. Do not do it.
But it is a funny bit where he's like, I'm trying to save you. You're gonna die.
And they look so sad
because he ate like bars of chocolate.
Yeah.
And the dog's like, why are you doing this to me?
Yeah.
He's like, I'm trying to save your life.
7, I have you help me trim her nails all the time. Hates it.
Yeah.
Actually acts like we're killing her. Hates it.
Yeah.
But sometimes you have to do it to make them feel better. And she has her IBD, and you see me shove medication down her throat all the time when she won't take it. And I'm like, if you just eat, you'll feel better.
Yeah,
but I can't tell you that. Yeah. And you can't tell me that. So.
And the betrayal in her eyes
she always
is
looks
unrivaled.
So sad. She always looks so sad. And then I bring her to the hospital, and she eats for another technician, and makes me look like a liar in front of the entire hospital. Animals are funny that way. They know also, I think, when you're trying to help them. Mm-hmm. Versus when you're trying to just.
Well, I think it's like really obvious things, like. Yeah. Obvious to them. I mean,
Sometimes I don't know when they're trying to help them, and all they know is that they're scared, and that they don't know where they are, and they don't know where their people are, and most aggressive animals that come in and see us are aggressive because they're scared, and it's hard to sit there and try to calm down a terrified animal and tell them it's okay, and they don't know what you're saying. They don't know what you're doing. All they know is that you're holding them down and stabbing them and doing tests on them and taking pictures of them and doing stuff that they don't want you to do to them, and it scares the living shit out of them, and I feel terrible doing that to some animals.
Yeah.
Because all it does is reinforce that the hospital is somewhere to be afraid of.
Sure, but at the same time, I mean, you got to do what you got to do.
Yeah, we got to do what we got to do. And sometimes it gets to that point where either we do this or this pet dies. Yeah. So we got to do what we got to do. But if we ever recommend to people, hey, please give this calming medication before your pet comes in for the next visit, we're not saying it just to sell you another product. We're not saying it just to make you pay more money for something that you don't need. We're saying it so that next time they come in, if they're on that medication, maybe it's a little bit of a better experience for them than it was last time. And maybe it goes a little smoother for us and for them. Every now and again, when 7 goes in for her boarding, I know she gets anxious. She gets calming medication. Jinx, the queen bee, as it be.
Yes.
I do not plan on bringing her into the hospital again without giving her gabapentin and making sure she is relaxed.
Yeah.
Because every time, she's getting older, so she's never been great at the vet's office, but every time I bring her in, it's a worse experience than the last time, and I do not want her to feel that way, and it sucks, because especially when it's your own pet, and they're screaming for something as simple as taking a temperature, and you're like, why are you like this? Why? The new kitten, on the other hand, when you start teaching them young that certain things are okay, touching their paws, touching their ears, touching them all over, touching their face, messing with them, rolling them over onto their backs, playing with them, like stuff like that. All of that stuff is desensitizing them to stuff that they might encounter in the future in the vet's office. We have clients that come in sometimes and go, my dog hates getting her ears cleaned. She won't let me do it. Did you touch her ears and play with her ears and clean her ears as a puppy? No, I never did any of that stuff. Well, she doesn't know what you're doing. So now it's a scary feeling. It feels weird. You're putting cold liquid down in her ear.
Yeah.
And again, they don't know what you're doing to them. They just know that they don't like it. And it's up to you as an owner, as their caretaker, their caregiver, the person that feeds them and takes care of them, to teach them that certain things are okay, to make it easier in the future.
It's hard to explain that to them.
It's very hard to explain that.
Some would say impossible.
It is.
So.
It is, and I feel bad every time.
Let's hop into our last one here.
Ooh, what's this one?
The Sailor Sunrise.
This is the one you said I won't like.
Yeah, probably. This is it's very rum forward.
Oh well, I like rum.
Okay.
So there's that. Okay. That's not bad.
Yeah.
Ooh, aftertaste. Aftertaste.
That's why this is here.
I gotta say, the Fatal Plus is killing me.
It's delicious. I'm telling you.
I made a joke. That's really good. This is good.
Yeah, this is... that cream of coconut.
Ooh. I'm glad it stayed good in the cabinet all this time.
Yeah, I was a little afraid. That can looked like it was like 5 years old. I was like...
You just had it for that long?
No, it's not 5 years old. No way. Maybe 3.
Oh, well. That puts me at ease.
If we get sick later, then we'll be in it together.
R.I.P. Eric.
Yeah.
He's okay.
He's fine. Oh yeah, I didn't explain that, and I'm sorry. Yeah, Eric. Eric lives some hours away, so that's the only reason he's not here. The band didn't break up or anything. He'll be back another week. My beautiful co-host here.
I miss him.
Yeah, I miss him too.
This would have been fun with him.
Yeah. He'll be back another week, so don't worry. But yeah, that's why he's not here. This is a very easy question. What is your favorite part about being a vet tech?
Oh, you would think that's an easy question, but it's really not. My personal favorite part of being a vet tech is the feeling that I get when people are so happy to see their pet go home feeling better. When I get to treat that sick 13-year-old dog that the owners thought that their time was done and everything was over and it was time to say goodbye, and I get to send that dog home for 3-4 more years.
Yeah.
And be like, everything's gonna be okay for now. And you get to have more time. That's the most rewarding part of it to me. Where I can see people's faces light up when, they brought in their dog that wasn't walking and now their dog's walking again. Or they thought, this is it. This is the end. This accident is gonna, take my friend away from me forever. And no, you got it just in time. Fluffy's gonna be okay. I keep saying Fluffy, but
it's a good sub.
It's a good sub. It's a pretty common sub.
It's like Spot.
That's what makes me happy at the end of the day. When I know, because it would mean a lot to me if something were to happen to one of my babies and somebody were to take care of them. I would want somebody to take care of my babies the way that I take care of other people's babies.
Sure. I mean, feeling like you made a difference as well, I think, is a big part of something like that, in any job. And I don't like the cynical belief that, everyone in the world sucks. I feel like everyone has that inherent feeling in themselves to want to make a difference, to make somebody feel good.
I like to think that too. I tend to be more of a cynic, unfortunately, and I do every now and again have that lapse in thought where I'm just like, okay, nobody really cares. But I know everybody in that hospital does care. They wouldn't be there if they didn't care.
Most people truly do.
Most people really do. I know all of our doctors really care. I know our practice manager cares probably more than all of us combined. She really, really, really cares. I know my boss cares. I know the other technicians care. And I know, God forbid, if something were to happen to Seven or Jinx or Gambit, and I wasn't there, that they would do everything to make sure that they were okay. And they would do everything that I would want them to do. And I know that I would want to treat somebody else as a stranger's animal with the same decorum and respect, where I'm going to treat them like they're my own pet, and I'm going to try to put my best foot forward and take care of them to the best of my ability and make sure that they're okay. Yeah. Because for some people, you'd be surprised how many people come in and go, this is my last link to my deceased ex-wife. Or this is my last link to my deceased daughter or son.
Sure.
Or somebody in my family, or my mother or my father. This is all I have left of them. And it's a dog or a cat. And it weighs very heavily on our shoulders sometimes when we're faced with that. But animals are not just objects. They mean a lot to people sometimes.
Yeah, they're family.
They're family. You have to treat them like family. They mean a lot to people. Like I said before, every pet has an owner attached to them. And some owners are more attached than others. Some owners are just like, it's my daughter's dog. But some owners are like, this is my daughter's dog.
In a weird way, you're dealing with a non-verbal like client in a way, like I'm transmitting it to like a human nurse kind of situation where you have a patient who's no longer verbal communicative. They're just kind of one of these in a state, and then you have the caretaker that is communicating their wants to you.
Yeah, kind of in a way. A lot of people bring up that similarity. I want to say, I think there's a better word for that, but I can't think of it at the moment.
Analogy.
A lot of people bring up that analogy, and I would agree. There are times where I personally believe that the pet very clearly shows us what they need.
Sure. Yeah. I mean, it's obviously it's not the exact same thing.
From a medical standpoint, like we can tell when an animal's dehydrated. We can tell when an animal doesn't feel good.
Yeah, absolutely.
But we do have a verbal patient and a nonverbal, or excuse me, I got that backwards. We have a nonverbal patient and a verbal caregiver, where the patient can't tell us exactly what's wrong, but the caregiver can tell us what they think is going on.
Yeah. Try to translate it a little bit, because it's their pet.
Right, and I never discredit anything that the owner says when they come in and give me that full history. And again, that's why I write down everything that they say verbatim, because sometimes there are very, very, very useful hints in what they're saying that can lead to a diagnosis. When they start talking, I've had like 5-6 years experience, so at this point I can start kind of gathering information, and I can ask leaded questions, if that makes sense.
Sure.
So if somebody comes in and tells me, yeah, my 16-year-old cat isn't doing so well, I can be like, okay, are they eating or drinking? Well, she's eating a lot, but she's not gaining weight. Oh, okay, about what food do you feed her? And they can tell me that, and I'll kind of keep going, and I'll be like, is she urinating, going to the bathroom okay? And they'll be like, well, not really, because I'm not sure why. But basically, from their answers and my questions, I can kind of lead them into, this is what I'm thinking, so confirm or deny based on my questions here what's going on, because you know your pet's schedule. They know their animal better than absolutely anybody. So if they say that something's wrong, I believe them. Yeah. I always believe them, even if animal comes in acting totally fine.
Yeah, sometimes I make fun of you when the dog is just gave you one look, like, and then you're like, she's sick, she's gonna throw up in about an hour, just wait. And then every time
like
you're
clockwork.
like clockwork, that dog will walk off somewhere
and start. Yep, because I know her.
Because you know her.
Because I know her.
Yeah.
Jinx with her freaking iron stomach literally can eat anything and vomit it up and be fine. Not everybody's that lucky. I think we had a cat in not too long ago that ate some plastic, and he was in the hospital for like over the course of a month because we couldn't figure out. Well, we knew what was going on, but it's not like without a foreign body surgery that the owner couldn't afford. We could fix it, and it sucks because I hate being met with those financial constraints, because not everybody can afford that. It's getting so expensive.
Sure.
So expensive.
With everything. I mean,
please get pet insurance. You're going to need it. Please do it while they're young, small puppies, kittens. Get pet insurance. It's so important. And that's Trupanion. We love Trupanion. But please get pet insurance. I don't have any on mine because I get a discount working in the field, but it's so important. That makes or breaks some people from deciding whether they're going to take their 10-year-old golden retriever who's got bloat to surgery to fix GDV, or there are certain things that come up that you don't expect to come up. And I am definitely, I don't push it enough, honestly. I really do think that pet insurance is important, and it helps a lot of people, and it helps a lot of people make decisions that they wouldn't otherwise make without the financial component. And that sucks, because a lot of people ask why is this bill so high? And I'm like, do you have insurance for yourself? And they're like, yeah, I only have to pay a $40 copay. And I'm like, do you have insurance for Fluffy? And they're like, no. And I'm like,
well, there you go.
Unfortunately, you have to kind of pay for goods and services rendered. So
gotta play the game. I mean, that's just life. I mean,
it is. I feel like people kind of also bring up but don't you love animals? Don't you do this because you love animals? If I loved animals and it got the bills paid, then, you know, I would do that for the rest of my life.
Sure.
If loving animals paid my bills.
Yeah.
But it doesn't. So I unfortunately have to make a living at some point or another as well. And I know a lot of the girls have side hustles. Yeah. And they have to, because the veterinary profession does not pay nearly as well as the human profession of medicine does. And not to knock any human nurses, I feel like we do a lot more. We do anesthesia, we do dental cleanings, we kind of do everything that a human nurse does and then some, but on animals.
That's a hot take.
It is a hot take. And I have mad respect for human nurses. Absolutely. Like, I will never knock a human nurse. I feel like they do stuff that I can't personally do, dealing with people.
Doesn't sound like it. It sounds like you want to beef with them.
My sister is a medical assistant. She does human people, and I do animals.
Well, and you're superior.
No. I honestly, she's always been more of a people person than I have, and I respect her for that. And when she was doing medical assisting, she deals with a lot of stuff. Well,
there's a whole other litany of things. There's a whole other litany of things. I mean, we talked about the downsides of, you know, being a vet instead of a, you know, a traditional nurse. But there is a whole litany of other downsides that come with being a nurse as well.
Oh, I'm sure. So, I mean, the girls and I talk about it all the time at work.
As not, you know, as close as the similarities could be, it's still apples and oranges. They're so different.
I believe that one of my coworkers actually used to work in human medicine, and she did used to work with elderly people. Yeah. And the stories she tells. Yeah. No, that's all I have to say. No. Not happening, not doing it.
Well, let's be thankful that you're in the right field for you then.
I love my job and I wouldn't trade it for the world. Is it frustrating sometimes? Yes. Is it very, very upsetting at times? Yes. Every now and again, do I wish that I did something different? No. I love my job.
Well, that's where you should be lying.
Right. I love my job and I would never trade it for the world.
That's fantastic.
Ever.
Well, let's wrap this baby up. We're going on a considerable amount of time, actually.
Oh, really?
Yeah. Thank you for being on, my beautiful soon-to-be wife. And if you guys aren't following, please like, comment, subscribe. Maybe have a little discourse in the comment section below. If you want to be on the show later, then please offer yourself up for sacrifice. And
we need a human nurse so I can talk to them. I would love to compare notes.
Yeah, if you're a human nurse, please, or anybody else, if you think you have something interesting to talk about or not. We're all just ordinary people after all. Please go watch Leaky Lounge as well, please. Or myself and
they're pretty cool.
And my once again beautiful co-host that I'm missing at the moment.
I miss him.
And his brother Noah and our editor Jess are all on there. So please check that out, and we'll see you in the next one. Bye-bye.
Bye-bye.